Let's talk about the NHS. There's two big stories around today. Well, I suppose one involves the NHS directly, and this is revelation that some doctors, some top consultants are being paid whopping sums for overtime to help clear the NHS backlog in terms of operations and treatments. Some being paid £200,000 more than they normally would be paid, usually working part-time for the NHS to help clear that backlog. Is that money well spent?
Well, Julia, let's start with why we're delivering these appointments. The elective crisis in this country has been going on for years, and it's affecting all of us, with over 7 million people on a waiting list. It's crucial to deliver these appointments quickly for the health of the people that we love and care about, and for our economy to get us back to full strength, to support people back to work and back to the lives that they love. But we shouldn't have to choose between filling gaps in a surgical rota at the last minute, which does cost more, and delivering people the health and care that they need. There is a better approach. It takes planning, it takes investment, and a well-delivered elective recovery. And it's promising to see a direction towards that from this new government, because we've lacked that for many years now, and it's costing all of us.
Well, yeah, look, we have got a huge sum of extra money that's been going in since COVID and onwards in terms of the NHS, but there was certainly a very big issue for a lot of years of, although money going up in real terms, it wasn't going up to match the number of older people who need a lot more healthcare. And, of course, the cost of healthcare goes up simply because there are new treatments, new operations, new drugs as well. Because I'm kind of you, people are being outraged by this idea, well, the doctors are being paid an absolute fortune. If these are top consultants, they're seeing a load of patients who need to be seen, I'm kind of quite relaxed about them earning big money. It just seems to be one of the things we should have been doing for a long time is these top consultants who working just mornings in the NHS and then spend their afternoons in Harley Street earning 10 times the money. Why don't we just pay them that money so we have them working in the NHS full-time, so you don't go to doctors, as happened to me on the NHS, and say, well, how long until that operation? 4 months. Or come to my Harley Street office, you can have it next Wednesday. So we just don't have that situation.
Well, that's the thing, Julia. We need an NHS that's back at full strength, back at its best, so we can get people the care they need.
We need it to be a lot better than it best ever was. A lot better.
Well,
that's not good enough.
Let's get the NHS to be world-class so people get care when they need it, and that we can rely on it to deliver the appointments when people are there, but also get us all back to better health. Because when we're seeing these higher cost or additional overtime fees, it's essentially because of a mess created by underinvestment in the past. The last government spent less on staff, less on investment in the name of efficiency, and then we have to plug the gaps. So, Julia, last week, my washing machine broke. I had to pay an emergency call-out fee for a plumber. That was paying through the nose. But the problem there wasn't the call-out fee. It's that I didn't have a plan to prevent putting coins in my pocket going through the wash. So let's plan out, how do we get the NHS working well from the outset, not plugging the gaps.
That would be a good thing. Well, we're told that one of the issues is people smoking. People doing unhealthy things, hence a load of sin taxes. But also we've seen the announcement today of that bill actually being introduced into Parliament. Of course, the bill that in its original form was introduced by Rishi Sunak and then had got through the Commons, got through the Lords, but actually hadn't quite completed its passage. But the government's now plans to make it illegal to smoke in children's playgrounds, outside schools and hospitals in England. Some places also going to be becoming vape-free. The tobacco and vapes bill will make it impossible also for anyone currently aged 15 or under to ever legally buy cigarettes, even once they become 18. This was what was under the previous plan. They're going to restrict vape flavours, the displays, the packaging, and also a ban on the sale of single-use disposable vapes from next June in England and Wales. That's already been announced. But one saving grace, of course, for a lot of pubs and hospitality has been pub gardens won't be included in this sort of effectively outdoor smoking ban. Those of us who are non-smokers, bit of a pain having to sit next to people smoking in a pub garden, but I'd rather the pub existed, and those smokers often keep those pubs going, so that's a deal we'll have to make. But I mean, do you think that this is going to make a difference in terms of pressure long term on the NHS?
This is a big step towards a healthier population and a shift from sickness to prevention. So, Julia, I also work in the NHS as a doctor, and I see people come through the doors of A&E in their 40s, their 50s, struggling to breathe because of a lifetime of smoking without the support that they need to stop or prevent starting in the first place. And what's really interesting is with this range of proposals, more smokers support these ideas than don't, because most smokers don't want their own children to smoke. And so it's about, as you say, taking a balanced approach that prevents children being attracted to vapes with flashy colours and flavours, that means that the age of smoking goes up, so current under 15s won't ever be able to buy cigarettes.
No, they will be able to buy cigarettes. They won't be able to legally buy cigarettes. That's a completely different thing. Because if you're under the illusion that under 18s don't buy alcohol, I've got a bridge to sell you.
Well, I think shifting our approach in terms of what's deemed acceptable or what's supported by the state is a big step here. And making cigarettes illegal with that raising age limit has worked or has really good evidence.
No, it hasn't worked. New Zealand wanted to bring it in. They can't. No other country has done this. There's no evidence that it works, other than the fact actually in New Zealand, what they've done with vapes things, you've got a massive black market growing.
So what we've seen with, for instance, the indoor smoking ban shifted rates down, and other steps of that sort have shifted the dial. But as you say, this would be historic. The evidence suggests that it would be another big sea change to reduce smoking across the country that would save lives, but it also would save the NHS and the wider economy.
Hasn't the biggest thing that has actually had an impact on cutting people's smoking has actually been vaping? And now there's a ban on single-use vapes, which is actually the way a lot of people start their vaping. I mean, vaping is... I don't like it, I don't do it, I don't want my kid to do it, but I'd rather that than smoking.
Well, I think that's where this proposal is a clear-sighted and balanced approach. By banning single-use vapes, by banning advertising to children, we're protecting children from being. But
why don't we just enforce the why don't we just enforce the law that already exists that bans the sale of these things to children? Why don't we just have 20 grand, 50 grand fine for any shopkeeper selling to kids, and we test it all the time, and they know you're going to lose your licence, you're going to be out of business in a week if you sell to anyone under 18. We could solve this tomorrow if we wanted to without another new law.
Enforcing the law is crucial, but let's use all the tools that we have.
Well, why don't we enforce the law we've already got first?
Let's do both to protect the health of our kids, but at the same time, as you say, vaping can be a tool to stop smoking for some, and what this legislation allows for is that to continue to happen.
But it also, but wait a minute, but it also
not labelled or marketed with cartoons, that can do that purpose to help people stop smoking without kids being drawn in.
Okay, and I agree with you on that, and taking away the sort of adverts, the Silk Cut and the Marlboro and the cool ads that people, certainly my age, were attracted to in their teens, taking that away. I can understand. However, we're not talking about kids in a few years' time. We're going to be talking about grown adults, in their 20s, 30s, 40s, being told, no, you're born on this particular date, you can't buy cigarettes, but your mate who's a day older can. We're talking about adults being prevented from doing something that is legal for an adult a day older than them, or a year older than them, or 2 years older than them being able to do. Two-tier adulthood isn't going to work.
Well, the thing we see is smoking affects all of us as a country.
No, it doesn't. It doesn't affect me. I don't smoke. It doesn't affect me at all.
But it does affect us, Julia, through cost on the NHS.
No. The tax paid by smokers vastly outstrips their cost to the NHS. That's not true. I benefit. Smokers pay a load of tax and they helpfully die early and don't get their pensions for so long. They're a benefit to me.
Well, Julia, I think that sort of reasoning wouldn't be the way I'd go about protecting health.
You made an argument that we're all affected by smoking. I'm saying the benefit. Anyone who doesn't smoke benefits from smokers smoking financially. That's not an argument.
At the moment, there's over 30 billion in cost to all of us from smokers who are unable to work, who are less productive, who are less able to pay taxes, and who do incur costs on the health care service.
I think that figure is questionable.
So let's protect us collectively protect our economy, protect our health, but also do it in a way that lets people use the vaping devices, that helps them transition to smoking or stopping smoking in the long run.
All right, really good to talk to you. Thank you for joining us, Dr. Annie Williamson from the IPPR. Thomas Slater, just got a couple of moments. Your reaction to that, because I know it's all about individual freedom and you're a libertarian. Where do you stand on this issue?
I just don't think it's the good doctor's business what people do in their spare time, whether they want to vape, whether they want to smoke, whether they want to drink. We used to understand as
sniff glue.
Sniff, you know, we don't.
That's what everyone did in my day. Teenagers sniffed glue. I'd rather they were vaping.
And it never did you any harm. The point is,
I don't know.
I just think it's a really miserable road we're going down. You're absolutely right.
They're coming for my wine next. I know they're coming for my wine next.
Why wouldn't they? It makes perfect sense. And the anti-smoking playbook is a playbook that gets applied to everything else. So even if you're not part of the minority now, a pretty small minority, which have been going down regardless of all these nanny state policies, as we're saying, who do smoke.
It's a tiny minority.
We're already seeing that in relation to unhealthy food. We're already seeing that in relation to alcohol. I just think, why not go back to a situation of live and let live? And let's get rid of this idea that, you know, my choices impact on other people. As you rightly point out, all of the evidence is in terms of NHS costs, healthcare costs, in terms of social security. By dint of not living as long, smokers tend to save money. So let's junk that argument and just say people should be able to do what they want to do.
If it's not imposing on me personally, it's really none of my business.
Really simple.
Yeah, absolutely.